a CEO of Saudi RPM, a subsidiary of Response Plus Holdings, Mr. Baneesh Abdulla.
Luckily, we have a good team, good leadership. So people like me, we are in middle actually. Leadership and real teamwork on ground.
Absolutely. Like you did not think that a certain job is below your experience, and it's not up to what you were expecting.
What all the sectors we work, we always emotionally connect our team. Even in our training, we impart this kind of logic to them.
Hey everyone, welcome back to FaceTime with Leaders powered by Directors Institute World Council of Directors. I'm Charu Mehra, and today we are diving into a world that sits right at the intersection of healthcare, strategy, and humanity, the world of pre-hospital and corporate healthcare leadership. Now, when most people hear emergency medical response or pre-hospital care, they imagine ambulances, medics, and flashing sirens. But behind that immediate response lies an entire ecosystems of logistics, governance, partnership, and leadership decisions that literally saves life before patients even reach a hospital. And our guest today is one of the visionaries who has built that ecosystems from the ground up, Mr. Baneesh Abdulla, a CEO of Saudi RPM, a subsidiary of Response Plus Holdings, the largest pre-hospital care at medical emergency provider in the UAE and one of the fastest growing healthcare networks across the GCC and beyond. With over 15 years of progressive leadership experience, Mr. Abdullah has been instrumental in expanding RPM's footprint across the UAE, Saudi Arabia, Oman, India, the UK, and even Norway, driving operational excellence, corporate governance, and sustainable healthcare transformation across borders. From starting out as a procurement executive in Kerala to becoming a CEO leading an international healthcare brand, his journey is a proof that with clarity, courage, and conviction, leadership can turn local dreams into global impact. Mr. Abdullah, it is such a pleasure to have you on FaceTime with Leaders, sir. How are you doing today?
Thank you. Thank you very much, Charu. Thank you very much for having me today with you. And it's great for having such a warm welcome. Thanks a lot. And it's a pleasure day today for me and the team. And I wish same to you and team as well. Thank you very much.
Wonderful to hear that, sir. Welcome once again. Welcome to the show. So let's get started.
Sure, please.
So every great leader has a defining story, one spark that set everything in motion. So, Mr. Abdullah, if you could take us back to the very beginning of your story, what first drew you towards healthcare? Was there a moment, an experience, or maybe a turning point that shaped the leader that you are today?
Great. Thank you, Charu, again, because this is one of the interesting questions which I would like to answer always. So
Right.
my healthcare interest basically it started from my school age. One of my neighbor got cancer.
Oh,
So even at that point, my thought process was okay. Healthcare is only for nurses and doctors. There is no other role for the community or management people in healthcare. But
right.
from that incident, I realized that doctors and nurses can do only the physical part of the patient. All other areas, let's say there is psychological, financial, spiritual, a lot of other issues which is
Right.
connected to a patient that can be managed by a non-medical person. So doctors and nurses can be, let's say, or major role to making physically correct. So
Right.
other role lies with the others. So
Right.
that was one reason which I thought about, okay, why don't I can step into healthcare? That's from my college age. Then my father was as a pain and palliative care volunteer, as they do a lot of administrative support for a patient rather than medicine and other support. From that moment, I thought about healthcare. When I did my college, then I decided to go for a clinical psychologist to support the patients and all. In that purpose, I joined into a organization. They do care patients, Then from that moment, I realized that all this gonna happen from us business support.
Right.
People there should be there to fund for these kind of things. Otherwise, these social organizations are no more. So I
Right.
was thinking, okay, how can I connect finance and healthcare together? So that's the reason I come up with a new idea. Okay, let's go for an MBA to
Wow.
learn business, then club that into healthcare. So
Wow.
now, like it's a great grace of God and my team and my family supported a lot to reach to this level where I can be in healthcare and same time I can do my the other passion like helping patients. There is a lot of companies that do commercialize healthcare. So
Right.
here take care of our reasonable margin from this business, but same time our top priority is always patient care. So
Wow.
that pre-hospital care because I started in a hospital in after my graduation as a procurement executive. So
Okay.
then even my chat with the doctors in the coffee time and all, whenever the doctors have the limitation to fix a patient if he is not clearly correctly treated on site. So
Right.
that's I thought more about the pre-hospital care kind of stuff. Then I preferred a company to join and work with them in the pre-hospital sector. So again, it's a journey started back in India. I was a procurement, then assistant administrator. Then when I moved to Middle East, I started as a receptionist in one of the pre-hospital care company. I'm heading the same company as a CEO now in
Oh,
another.
wow. That is wonderful. Wow. Wow, so this your story. It sort of feels like less like a corporate climb, but more like a real li life masterclass in transformation. You sort of you the way you said that you started as a receptionist and now you are the CEO of the same company. So it feels like you've not just grown within the organization. You've sort of evolved with it. So that is so wonderful to hear a leader speak about their uncertainties, their wins so openly. So thank you for sharing that with us.
Thank you. And for the generations, now I can see the people, even my colleagues, they were at the reception at the same time. What was the difference is I joined, it was in another part. India, I was the same hospital, I resigned as a assistant administrator.
Okay.
It's responsibility. Then came to Middle East, let's say in Abu Dhabi. Then I am starting as a receptionist.
Receptionist.
Never complained. I done my best as a receptionist.
Yes.
So three times Star of the Month award based on the patient's
Wow.
feedback. So, but I had some other colleague, they were saying, "Oh, I'm not for this position. I am more than this." So, no, whatever I got, I did my best. So, when there is an opportunity to promote from three of us as a project coordinator, I got the chance
You
because
got
I'm doing this job
that.
best.
Right.
I got the chance. So, that's the way. So,
You,
believe
yeah,
in
please
what
go ahead.
what I believe in, whatever what are the positions or responsibility we have, do it best. The next will
Absolutely.
come automatically. That's
Absolutely. Like you did not think that a certain job is uh, below your experience and it's not up to what you were expecting. And you took it on and you did it wonderfully. And that's the reason you are where you are today. So congratulations on that.
thank you, Charu. Thank you very much.
So let's step inside your world for a moment, the world of pre-hospital care and medical operations. You're leading Saudi RPM, managing operations that stretch across multiple time zones, industries, and emergency networks. For those outside this ecosystem, can you paint us a picture of what a day in life of RPM looks like? What are the moving parts that keeps this life-saving engine running, and what does it take to lead it all in sync?
Thanks, Charu. It's more a professional question related to my day-to-day activity as well. So here, I would like to mention about my chairman. He is a great visionary leader, Dr. Shamshir. He started from one hospital, now is running more than 25 hospitals in the region. And this pre-hospital care company was built based on his vision to ensure proper care on site. And he's also in the same page. He's getting a lot of feedback from the doctors whenever patient reach hospital. Some damages they cannot fix if they are not taken care well on
Right.
site.
Right.
So be more rather than the normal pre-hospital care or the above the traditional level, we emphasize more training to the people. Okay, we ensure training, drilling, continuous education for the people who is working on site, because emergency can come very hardly. Maybe they get one emergency in a year, but that's a life. If they
Right.
are not, it's a life. And many road accidents, we can see the way they pull out a patient from a car. If it is not right, he get permanent, paralyzed
Yes.
kind of situation. So we ensure that train the people always, and look after our people well. So now I'm 15 years into this organization. All the team leaders of the company, they are more than 15, 20 years in the same organization. So we ensure our people are taken care well at site. There, including mental well-being. We are doing a lot of mental well-being initiative for our people and the people who we takes care. That
Right.
makes our workload less, basically. So
Absolutely.
on an offshore site, we focus on their mental well-being, especially when they come after the vacation. He going to another mindset. So we have a special program to take care of such people. So we do prevention to ensure less emergencies happening in our site. That makes our work very easy.
Easy.
So I would like to mention that my steps is really followed by my chairman. So he put the vision to us, and we always look the blue ocean, the new things. Now we are working with the government in this country
Oh,
to enhance the pre-hospital care in the region. So we always go a step ahead in all the place wherever we work. So that's the one reason companies are recognizing us. Government is trusting us in a way, because they are giving their heart. The emergency, public emergency is something is very very important, and we work on
right.
airports, seaports, and international events happening in the country. So something went wrong, this affect the organization and oil
Agree.
and gas and other areas of the country. So if
Right.
they should trust a company to, especially a healthcare company, to operate their site. There should be some passion, some people with a passionate about this.
Absolutely.
So luckily, we have a good team, good leadership. So people like me, we are in middle actually, leadership and real teamwork on ground. So we manage it in between. That's the way it's operating.
Absolutely. But you are the people who run it like an orchestra. It doesn't sound like an operation. It's more like an orchestra running smoothly.
Yeah, exactly. Yeah, the people on ground, they are the real people brings result to us. Actually, we
Right,
are the people bringing the results. So,
right, right,
uh,
right. Wow.
so we take care of them. We ensure their things are smoothly run around. We always keep people in a pool. If there any person have any emergency, next flight he can go to home country or wherever he want. The another person gonna back him. So that's the way the culture we develop.
Wow.
So, yeah. So that's the reason we are not missing our expertise on ground, because
Right.
once we develop, he's always with the company. So that's the way we.
Absolutely. And that really, you take care of your people so that they take care of the patients of people coming in. So that is wonderful. It almost felt like looking live into the heartbeat of the RPM, the coordination, the humanity, and the purpose behind it all. So that's a wonderful job done, sir. Kudos to you and your team.
Thank you very much. And recently one example I would like to quote. Our chairman met one of our senior person. He's going to be 50s now, so he
Okay.
want to retire. So chairman immediately asked, okay, what is your son or daughter is doing? Get them on board to the company.
Oh, wow.
So yeah. So
Wow.
that's the way. So that message, of course, it's gonna spread. So most of our people working in this company is just like a life insurance they're taking in. So if something there, we will support.
Wow. But this is such a nice gesture because people then become they feel secure within the organization. if
Exactly.
we are giving that level of comfort. So wonderful job done, sir.
And the development, what is happening, so I am one of the example from a receptionist to CEO.
Yes, absolutely.
Who is contributing, who are ready to volunteer, or we are ready to come up, organization is open for them.
Agree.
So, so
Wow.
that's the organizational thing we can.
So you've also led some massive transformations, integrating operations across the UAE, Saudi Arabia, and Oman, acquiring companies like Ocumed and Prometheus Medical UK, and even listing RPM on the Abu Dhabi Securities Exchange. That's huge. Now, take us inside that transformation journey. What was it like leading through such high stakes change, and how did you ensure technology and expansion become enablers, not obstacles for your team?
Thank you, Charu. Another interesting question I could say. The organizational journey, we started, as a six site clinic in 2010, and now we are running more than 400 clinics in the
Wow.
region, taking more than 1 million people on site. So that is the size of the company. And from 10 ambulance in 2010, now we reached 450 ambulances on and helicopter emergency. All is clubbed in the services now.
Right.
The basis is the visionary leadership. Our chairman and team, they had a right vision where this to be taken into. So the roadmap was quite clear. Okay, once the company is reaching into this level, listing. Okay, after listing, you have to go for an acquisition. So the vision was very clear, set, and we customize our product based on country's requirement. Let's say I moved to Saudi Arabia in 2019. So I was working as a business development manager in Abu Dhabi, the same company. So the market was saturated for us. All the government project we got and the oil and gas. We thought, okay, what next? Then Saudi is the best option. Then who should go to Saudi? Then I raised my okay, I can go to Saudi. Then I moved from business development manager as a country manager to Saudi Arabia to establish company here. So I'm the first one came in Saudi now as a first employee. Now we have 600 plus employees in
Wow.
Saudi, medical team and ambulances as well. So so the journeys from a single point, single on pre-hospital care company reached to this level is one thing is vision, and secondly is we are the only pre-hospital care company listed in public domain nowadays. Even none of our competitors are listed in the public domain. So
Wow.
that is another advantage. I could say the leadership vision, and of course acquisition. It's part of the journey. Once we reach to a certain level, we have
Mhm.
to club others. So Ocumed acquisition, where we found this company is more similar to our core or supporting our journey than acquire. And acquisition, as you know, there is a lot of steps to be followed, due diligence and all. And end of the day, it's a management commitment. While seeing this company, we have to ensure to the board, yes, bring it, we will run it. So that's a
Right.
way when corporate have agreed for the three acquisition, Ocumed and Health Tech Training Center, and recently Prometheus. So Prometheus was a international company. They're based in UK, owned by US company. So it was quite a very big journey of Prometheus acquisition, and we acquired the entire company, UK, UAE, and this region as well.
Yeah.
So if we have a good vision and people to run around it, then things are possible. And now we are moving forward listing our Saudi company. It's called subsidiary listing. It's a new concept. So leadership is saying, especially our chairman is saying, okay, guys, you can do that. Then we go, okay, how we can make it up. So that's the company journey actually, from a single company to a public listed company now. And always, since it's a very niche service, people are interested to know what is this company, and
Yes.
it is very visible how
Yes.
companies are going. And wherever we listed in a UAE stock exchange, Abu Dhabi stock exchange now, so our shares are doing well.
Okay.
So now there is more questions coming up when you're going to list in Saudi. So if we are doing good, then people always recognize
Right.
that.
Right. Right. Absolutely, sir. And what I believe is that from what I've heard, you really uh, need to have a good leader, someone who's able to lay your vision and the plan so that people can follow it. That is very important to have. And the
Yes,
way, the way you acquired Ocumed and Prometheus and threaded it into the same narrative, that really brings the scale home.
exactly. Yeah. So I would like to mention the layer. Okay, the chairman or team is setting the vision. There is middle management to, to roll out
Roll up.
and convince our team as well. We need.
Absolutely.
So that's it. So
Absolutely. They are the people who actually work on the plan laid out. So,
yeah, exactly.
absolutely, that is important.
Great teamwork, basically. It's a great team. And
Absolutely.
everyone knows, even if you can call anyone in our organization, they know what is the company is doing, what are the projects we are working on. So I feel that commitment from everyone. And we always keep that, even my office boy is my project team. So if he's not cleaning the table well, I cannot get this comfort. So
Absolutely.
my office boy is also my team, project team. That's the
Oh,
way the culture is set. So that's the reason the message is very clear to everyone. What is the organization, where it's going?
and probably that's the reason why everyone is on the same page and working equally hard to ensure
Yeah,
that vision is achieved and the goals are achieved.
yeah, exactly. And in the special project, we always all on ground, including, let's say, Hajj, the biggest gathering in the world. So we operate emergency medical service for Hajj. So one feedback from the government sector we got, in your company, we cannot realize who is the boss. So that's the way.
But that's a good feedback.
That's the way we work and deliver our services. So
One.
and yeah, we are a project company actually. We take the project, but many places we have long-term contract. Let's say, oil and gas and all long-term contract.
Right.
So when we start with a client, they stick with us for a long time
Mm.
until the project finish.
Right. Wonderful. That was really a rare behind the scenes look that I got about the company.
Thank you.
So, Mr. Abdullah, your leadership is also known for strong governance and compliance, especially in an industry where precision literally saves lives. How do you build a culture of zero compromise when it comes to safety, compliance, and accountability across such a wide organization?
Thank you, Charu. Again, it's a most related to my work-related
Work.
question, which I always pleasure to answer. We are a company, as a company into pre-hospital care. We cannot hide anything. Our things should.
Absolutely.
So once my team attended one case on site. We are responsible to justify. Uh, One thing is the government part and other things, and our team, we have trained in a way. If you are treating a person, if a labor, a family is waiting for him. If you are treating a kid, we are doing a lot of universities and school projects. So if you are treating a kid, mother or father or siblings are waiting for him. So what all the sectors we work, we always emotionally connect our team. Even in our training, we impart this kind of logic to them.
Mhm.
Okay, one example we normally say that, okay, if you find a person got an accident and laying side of the road, either you can decide if God decided him to die now, maybe he died, or you can drive your car and go. Otherwise, you can have a thought process stating that, okay, God is not decided him to die now. Someone hit him, so he's struggling with his life, so help him. So whenever our team jump to help a life, it is always in their mind, God is not decided him to die now, so help him to revive. So that's the reason in our last month statistics, in all our company, we attended 36 heart attack cases. Out of that, 34 we revived heart
Wow.
attack cases. So that is the basic of our service. So we are handling with it life and death. So I cannot compromise on compliance part, because whenever any question comes, okay, who attended this case? Who is this company? So what is their authority to touch the patient? That is very important for us. So we ensure all the compliance part are met before we are on ground. And
Right.
other part, the compliance issue is, okay, whenever we go to a new country or a new place, there could be different methodology.
Right.
Apart from the company registration, we have to have special registration with those companies to ensure our service is delivered. Otherwise, if client like us very much, okay, they want us on board, no, we cannot. If you are not met with the compliance issue. So
Right.
always we look after the compliance in all levels.
Right.
So
Sometimes there are requirements based on different laws. A different company would have different laws, and you have to adhere to those. And
yeah,
I
so
kind of feel that your company sort of imbibes that humanity into your team members so that when they are taking a decision, when they are acting on a case, they have that inside, not just
yeah,
thinking about it as a theoretically, logically, they're thinking about it as human as well.
yeah, correct. Yeah, even our brand film, which we did first brand film in 2015. So it's all talking about behind what happens. Okay, let's say we do international events, medical coverage. So if a jockey fell down from a horse, so the people who's attending is thinking about his family. A son is waiting for him. So once the treatment done, he go to his back home. So that's the way we put mindset for our.
Science, absolutely. And you are in kind of a industry where governance cannot be theoretical. It has to be practical, and it has to be it has to be done. So you can't just talk about governance in your papers and do check boxes. So rightly,
Always
examples that you gave really proves that.
Yeah, exactly. And always the government regulations that is to support the ecosystem, right? Okay, if saying okay, X person have to have a license. Let's
Right,
say here in this part of the world, the doctors and nurses before you touch a patient, you have to have the license. And secondly, there is a malpractice insurance. That means if anything went wrong, this patient can claim against the doctor or nurses and you get the money out. So
right.
we sure all this is in line even it is adding up cost to our service. We say okay, this is our service, this is the cost. So we never compromise on the compliance and compliance part definitely. And of course the ESG and other things we are following in because we always looking the future how it's going to turn
And
around.
that's the need of the hour as well right now.
Yeah, exactly.
All right, great, sir. Kudos to you, and I'm really happy to learn about this, about your company and what you're doing. So thank you for
Thank
that.
you very much. Thank you very much for this opportunity actually.
All right, Mr. Abdullah, time for a quick detour, rapid fire round. I will give you short questions, and I want instant, spontaneous answers. Ready?
Super. Ready? Yeah, super.
Okay, first one. What's the first thing you do when you wake up?
I drink couple of cup of water. Then I normally go for prayer, then stretching, and 5 to 10 minutes of exercise. Then routine starts. Yeah.
Wow, great. Okay. Your go-to comfort food after a long day.
To be frank, it depends on the timing because long flight. If I reach at home in the morning, I like to have the breakfast. But normally in the evening time, I would like to have some soup or so. It basically
Depends
depends on the
on what time of the day you are at.
yeah, exactly.
Okay,
And I
one
like to
hobby. Sorry,
sorry.
go ahead.
No, I like to travel a lot,
Okay,
and the reason I prefer big country to operate. So there is a lot to
yes.
operate. Yeah.
Okay, next one. One hobby that instantly relaxes you.
And reading management books.
Oh, okay. Nice. All right. A movie you watched way too many times.
I could say I like a movie. This guy, Tom Cruise movies, I like very much.
You like
The
watching.
re Yeah, the reason is the person who is doing a lot of struggle for his job. You know, yeah, because to maintain his job and his career, he's doing his life-threatening ish things, right?
Right.
Jumping. While looking at him, I feel okay, my job is very easy. I promote my team also. Okay, watch Tom Cruise movies, especially Mission
Mission
Impossible movies.
Impossible.
Yeah. One day my wife asked me, what is the reason? Tell me you like him. I told him this is the only reason. He took lot of struggle for his job.
That's a good point of view. All right, next one. One app you can't live without.
App, of course, WhatsApp nowadays,
Yeah.
connecting family, friends, and all in one. So, including client. Now we are
Right.
all
Everyone is on WhatsApp. Easiest
exactly.
way to connect.
Correct, correct. Even now, clients, now we are always on WhatsApp. Email is only for official documentation and other thing. All other thing, WhatsApp, WhatsApp. So
WhatsApp.
now it is WhatsApp. We don't know what is the future actually.
Yes. Okay. Your favorite place to travel to?
That is, of course, Kerala, my native
Oh.
place.
Wow. Okay. Next one. A song that always lifts your mood.
To be frank, I'm not a song fan.
Not a song person.
But whenever I get time, I used to listen motivational speeches, and I very much like management and business related talks.
Everyone has their preferences.
Yeah. Then I normally enjoy songs when with my family. If my wife wants to play something or my son, I used to listen to it. But if I'm alone, no.
No.
Some
Okay, next one. Your all-time favorite sports person or team?
sport person, of course, Sachin Tendulkar, because that was my age
Team.
when he was hero. And team in the sense in the 1984, right? 84, our Kapil Dev's cricket team, I like
83, the World Cup winning team.
the team. So that I got more insight about what all the things was happened when I saw that movie.
Movie. Yes, yes.
Then I realized that this is the way a team to be built up, a leader. So I like as a team, his Kapil Dev's team, and as a sportsman, Sachin Tendulkar.
Sachin. Okay. Next one. One thing on your bucket list you still want to tick off.
I want to be the chairman of a public listed company.
Oh, wow. Wow. You're getting there, sir.
Thank you very much.
Okay, last one. If your life had a title, what would it be?
Oh.
I mean, it's okay if you don't want to answer or if nothing comes to your mind, we can skip it.
I think better to skip it. I have to think about
No
it.
problem at no problem at all. Okay, that was still, I mean, you did not answer the last question, but it was still fun and spontaneous, and I really loved knowing you as a person, and I'm sure our audience will be too.
Thank you. Thank you. I hope so. Thank you very much for your time.
Great.
And
Okay.
I'm making it more interactive. Thanks a lot.
Yes.
Because as you're listening, I'm interested to talk.
So, Mr. Abdullah, the healthcare industry, like every sector, has had its moments of reckoning, from ethical lapses to governance challenges that shook public trust. When you look at those global and regional wake up calls, what do you think is the biggest lesson for today's leaders? And what have those moments taught you personally about doing the right thing, even when no one's watching?
Yeah, good question, Charo. Because healthcare industry now, all other industry like oil and gas or construction, they're talking about ESG, environmental issues. But healthcare, from the beginning, we have limited. I mean, if you're taking in terms of pollution, now we almost move to the, I mean, consumables into a reusable kind of stuff.
Right.
And we are going back to the old model. Maybe you can maybe remember when our childhood, we used to see the glucose and other things in the bottles, which can be yeah, which can now
So,
that
glass bottles, I guess,
yeah, now it's turned to plastics. But again, there is a thought to
coming
go back.
back. Okay.
It can be reusable. So we are in a line to think about how we can reduce the wastages, protect the environment. Let's say our movement, logistics vehicles, now we are converting it into electric vehicle kind of stuff, even for ambulances as a first responder. And other area, technology and other part, to reduce the paper usage, manpower and all. We are working on it. So the way we are looking forward, we don't want to lose any positions or job loss. We are utilizing them to other issues. Like let's
Right.
say receptionist job. No one is training them to take care of the next roles. They're ending up there. So rather than that, okay, train, let's say a robot in the reception, take this person to the other productive job. So
Right.
way we are moving forward. And 2034 is our, I mean, go green kind of a lot of initiatives are happening in pre-hospital care. So as a group, we have a hospital operation as well. So I involved in a couple of committees, this and that. So we know what is healthcare going to be in the future. And our chairman's vision is maybe in the future, they're not going to be the buildings for hospitals. Maybe from the home, you can see your X-ray. So that kind of stuff gonna come in. So as a leader, of course, whoever is in the healthcare or any other industry, if we are not looking at the future and start transforming now, we're gonna out from the market.
Absolutely.
Absolutely. Things we can see many, and in our industry, even some competitors used to come in the market. They might have, I mean, cut short the, I mean, shortcuts, to capture. We cannot see them for a long time. So our vision is, okay, let's build this company to work for our next generation, and at least more than 100 years, this company should survive. And above that, then that is up to the next generation. So our thought process now is you can see people are traveling to space, right, for the tour. Now Elon Musk have developed. So space is a remote site for us. So we are training our team, okay, how to do pre-hospital care in space. So that's the thought process is going on. So we are a very futuristic kind of company.
Yes, and I also feel that when you talked about taking shortcuts, it sort of is, and it is for all industries, but especially in healthcare, it also is a matter of ethics. You take shortcuts to have quick gains, but in the end, it impacts the lives of the patients, of the people who are coming in and who needs urgent healthcare. And as I said earlier, that ESG is the need of the hour right now. That should be one of the prime focuses of an organization. So.
And in many organizations, I could say, because of trained board members and leadership, they go wrong in many places. Some we can. So that's the one reason I prefer to attend this course. Actually, we'll come to that later.
Yes. Okay, that's it. Thank you so much for that answer, sir. And it really shows, it really shows great promise when we hear a leader talk about ethics that kind of feels personal. So thank you for that.
Thanks a lot. Because healthcare is the place where most of the, unethical things can happen. Because we are taking the advantage of their health. So having this kind of people on ground is important. So that's the reason we are, okay, our leaders are good. They have very ethical vision. That's why we are with them.
Absolutely. Great. So you're also a part of Directors Institute, currently pursuing the International Corporate Directorship Program. What inspired you to join the Institute, and how has this experience reshaped the way you think about leadership and governance at the board level?
Thank you, Charu. It's another interesting question. Because when I attended first time, to be very frank, the seminar I attended in Dubai, my intention was in the future, decision makers going to be the board members. Now, many family companies are listing. So to influence any organization, we have to have a network with the directors. So that's the reason I attended this meeting. So while complete the seminar, I thought, okay, why don't I can be a board member? So that came from that seminar itself. Then I thought, okay, let's do it. Let's enroll for the course. And for me, now I'm reporting to board and chairman. So for me, right, the CEO's life normally it 10 to 15 years. Then we have to retire. There is no option, and we have to give the pathway to the generations as well. So what is next? Either I go home and do nothing, or be in a couple of boards and enjoy the rest of the life. So then I would like to thank Directors Institute to get me into this thought process. And I recommended many people as well who is looking for the next option or what I can do next. I told the director is the very good option. If you are an industry specialist, it's a good option, one. And secondly, we know, or my colleague, the CEO network, I know people are struggling because leadership is not trained in terms of ESG and the current issues. If they are not trained, this management gonna struggle. They cannot convince them.
Right.
Yeah. So that was a basic reason which I enrolled with the Directors Institute.
Wow, thank you for that wonderful feedback about the institute, sir. And I also, thank you for being honest with us about your intention of taking this up. And looking at the experience that you've had, uh, being in the boardroom is a natural next step for you when you think about your career till now. And you're taking up this course and you're still looking forward to enhancing your knowledge is really inspiring for us. So thank you for that. And I wish you
Yeah.
all the best for the goals that you've set for yourself.
Yeah, exactly. Thank you. And as you rightly mentioned, Charu, maybe okay, it naturally come to me as a board position. So while I'm sitting in a board, before that I have to train.
Yes,
Otherwise, my CEO gonna tell, okay, what is this guy? He's not.
absolutely. You're preparing for that role in advance.
Exactly. So become a trained board member is my goal, because what all the positions so far I handle, I got. I'm lucky to say that I done it well. So of course the next I have to do well, and of course it's a
Absolutely.
great plan for the future as well. So as once I enroll, I feel key. No, I don't want to go back from my career now. Okay, it's a long way ahead. So. Thank you. And so I
Wonderful. I
recommending this
wish
to.
you all the best for your goals, sir.
Thanks a lot.
Mr. Abdullah, this has been such an energizing conversation. What really stands out today is how you've shown that healthcare leadership isn't just about systems and protocols. It's about foresight, compassion, and the courage to lead with integrity. You've built organizations that save lives, but you've also built cultures that sustain trust. And that's a rare combination. Thank you so much for joining us on FaceTime with Leaders, powered by Directors Institute, World Council of Directors.
Thank you very much. Thank you, Charu, for a very very much interesting session. I really enjoyed talking with you. So all the best, and I wish many people take advantage of this on time, because I know in my age there is a lot of corporate leaders. They are looking for the next option. Some of them are frustrated. Okay, after this position, what I gonna do? For them, if they are landing on a right place, they can feel much better in what they're doing now as well, because normally there is a say, once you are a CEO. In my last IAM management program, professor have shown me, okay, in the top of the mountain you are a CEO, so what is next? So there was nothing came to my mind even at that point. Now I can say clearly, next is board. So how you can say, okay, I'm a trained board board person now.
Wonderful, wonderful. Thank you for that, sir. To everyone listening, I hope today's episode reminded you that leadership, whether in healthcare or business, isn't just about reacting fast. It's about building systems and values that last. I'm Charu Mehra. Until next time, stay curious, stay grounded, and as always, lead with integrity. Thank you.